Welcome everyone, thanks for being here. I think most of you have been here, but if you haven't, this is the Emergency Services Headquarters. We've been here since May of 2022, and it certainly served us well. So I guess I'll start. Ashley, do you want to say anything before we dive in and kind of start?
I think you'll hit the highlights as far as why we're here and who we are. Just again, recognizing the commissioners here. Ms. Garner is out of town on a family trip, but sends her regards. But again, generally we're here to report on what we've been doing, and part of the goal too is not just tonight, but including tonight, hear input and feedback from community members that can go to the commissioners about how these settlement funds should be spent in the future. So that's why we're here.
Yeah, so like Ashley said, part of the MOA or Memorandum of Agreement for the opioid settlement funds is that there's at least one annual meeting held where it's open to the public, stakeholders are invited, so city, county, town, and that's held every year. That's on top of other stakeholder meetings like the MPSA meeting and things that we also attend. So tonight my goal is to kind of recap like we always do with overdose trends, statewide and local, and always the caveat that the EMS data does not paint the full picture, but it's what I have access to and can kind of give you some insight. And then look at where we've been with opioid funds and kind of how we're stacking up. I really wanted to see this year, what do we look like in regards to other counties across the state that we compare to? And then, of course, discussion, any updates from the group, and then, of course, any feedback or input as we've been through a couple of processes now. So without further ado, we'll get started. So a lot of you know Taylor Leopold was the substance use disorder coordinator in 2024, and she transitioned out earlier this year and took another position elsewhere, and so she still remains part-time here. We were thankful for the time and effort that she put into really the heavy lift on the reporting end. So this position was created specifically because of all of the reporting and the documentation that's required, and I want to show you a little bit about that. Ashley will as well. So introduce you to Ashley Boone. She's been with McDowell EMS since 2023. She's a paramedic. She also previously, prior to 2023, was 5 years full-time with NEDA, so economic development, been with the county for many years, and has a lot of good insight and input and a lot of good administrative skills for this report building. So really familiar with grants and reporting and all of that. So she's been a godsend as the report was due in September. So let's talk a little bit about overdose trends in McDowell and what that's looking like. So this is just from 2020 until 2025. So I think we all felt the upward trend post-pandemic and what that felt like. So these overdose volumes are not just opioid overdoses. This could be methamphetamine, alcohol, but what you can see here is the Narcan trend line that kind of goes with that. So the majority of overdoses that we respond to are opiate overdoses, and that tracks with the Narcan administration. And so you can see we've really trended back down to that 2020 volume, or even a little less actually on the overall volume. So I think we're on the right track. Again, this is one kind of snapshot of a multifaceted issue, and we know that, but it was nice to see overall that we're trending kind of back down to the baseline here from 2020. What I don't have, and I'd love to one day when I'm got some extra time, is to dive into the pre-2020 data. That's on a different platform. We switched to ESO in 2020, so it would be a manual pull for me to look into that, but certainly am interested in doing that to see, again, how we're doing and where we're going from here. So any questions on overdose trends?
Is that just the EMS?
Yeah.
Volume,
This is
or
only EMS.
So it doesn't include sheriff, police, or anything like that?
Correct. It wouldn't include if law enforcement went out to someone and they thought substance use was an issue within that call. This is truly just 911 EMS calls and what those volumes look like.
And what do you attribute the good decrease in those numbers? What was?
I think
is Narcan?
just anecdotally speaking, from my perception, The resources that have come in, I think from 23 on, kind of the ecosystem, the recovery ecosystem at McDowell has improved. So partners like Tim, like the Mission, like NPSA, it really has changed. Even from our standpoint, where we used to struggle is we would respond to the call, we brought in peer support, but we didn't have local resources to actually refer these folks to. And so we're starting to see a little turn in the tide there, but I'll also open it up to anyone else in here that is doing the work to see your perspectives on
So
decrease.
is this decreased death by overdose?
This is not death. This is someone called 911 because they overdosed. That's the primary impression of the paramedic, whether that was alcohol, methamphetamine, opiate. So those are the 911 calls that are overdose types.
I think there's a lot of general thoughts that the fentanyl supply has gotten weaker also, in somewhat of a devious way, because you don't want to kill off your clients. So there's a lot more morbidity and not mortality. People are having more wounds because of what fentanyl was cut with, and just mental health, but less death. And then Adrian can agree or disagree with that. A lot of calls, there aren't calls because there's Narcan everywhere now. So a lot of folks deal with it in their own private space, and so there's less calls that are made when someone overdoses.
Yeah, and that's why I say this is one snapshot for sure. I totally agree with morbidity and mortality, two different things. And a lot of times we ourselves can wonder, why aren't people calling 911? Is it that they have access to harm reduction or weaker versions of fentanyl, those kind of things. So the 911 call is not the only piece. It's just what I have access to provide tonight.
Like I'm sorry,
No, go ahead.
I didn't see it.
No?
We still, every week, people say I overdosed. I overdosed last night, and this guy overdosed 2 nights ago. So there's a lot of self-treatment.
And I was at a state conference that showed similar data, and I think there's much work still to be done, because I think substance use is still on the rise, but we've done a really good job at preventing overdose.
Yes, agreed. So substance use and harm reduction, two different lanes, and as they intersect, doesn't mean that people are using less substances. It just means they aren't having to access 911. Some of that is positive, some of that's because it truly is trending down, and then other things are the things you're not going to see here on this slide. So all good points. Thank you. So statewide overdose trends, these always look so incredibly busy to me, and kind of the main highlight here is overdose deaths across the state are still extremely high in general. And though we've seen some decline in those, and a lot of this data that you see later here is not quite accurate because it takes some time to get things back, toxicology reports. So this isn't a full picture of 2025 yet. We really have to see that later on, and probably into next year is when we would see that. So I always warn people, don't let these downward trends kind of fool you, because the full picture isn't there yet. But a really busy slide to say overdose deaths are still an issue across the state of North Carolina.
Looking year to year on that last slide, if you're looking at month to month, does it normally go up in the springtime and come down in the fall and winter?
What I have seen, and I think there's another slide here, because this is deaths, I've seen spikes in summer and fall. And that's what let me see if,
That's cool.
yeah, right here. So I've seen spikes in summer and fall is typically where we see our volume spike with overdoses.
Where does McDowell County stack up in comparison to the rest of the state? As far as
There it is. So here we are. So you can see McDowell is in the dark green here. So meaning we still are in that top tier of overdoses, opiate overdoses across the state. So while we're seeing those trends steadily decrease, we're still across the state, we are still one of those counties that is seeing a higher per capita overdose rate. Questions? Any other questions or comments here? So again, switching gears and talking about the actual opioid settlement funds, one of the things that I wanted to look at this past week actually was, all right, here's how much McDowell has received and here's how much we've spent, and what does that look like when you look at other counties? And one thing I love about the opioid settlement fund dashboard, and I encourage everyone to visit that. If you Google opioid settlement funds for North Carolina, it will pop this page up and I'll show it to you in just a minute. You can look at everything from every county. You can look at spending resolutions, spending reports, impact reports, financial plans. It's all there and available. I like to use this to see what are other counties doing and kind of, measure success, or even look to collaborate with folks and say, hey, I see you're doing this project. How could that look in McDowell, or could we partner and not create the same thing twice? So here you can see, if you go to the website, this is what you're going to see, is that McDowell County has spent $424,386, and you can see the categories here. Caveat, that's from summer of 22 to summer of 24. 2024, that fiscal year, July of 2024 until June of 25, there was no funds expended because the hurricane kind of stopped everything dead in its tracks, and we didn't do a process that year. This current year you won't see on the website, but I wanted to put this here to show you all. So this current fiscal year that we're in, those are the dollars that have been spent. So we're right at $900,000 expended, or in play here for the different community groups. When you look at the spending rate comparison, so I wanted to look at what counties are similar in size, in socioeconomic status, and then some of our rural counties, and see what are the spend rates of these counties, how fast are they getting these dollars out the door. And I was really proud to see that we're at a 33.8% spend rate, which is well above what you see some of these smaller counties doing. I think it comes into play when you see, well, why aren't these smaller counties spending money? Administratively, there is a large burden for every dollar spent. The things that have to be tracked, the documentation kept, the reports. It's a lot of work, and I think it can easily overwhelm counties. And so I was really proud to see, and I think this really comes from, we know that first year, a lot of collaboration went into the MPSA meetings, and we worked all through that holiday season and got that money out the door. Obviously 2024 threw us for a loop, but I think we're back on track in 25 and have done a really great job of being responsible with these funds in a way that gets it out the door, also provides investment, but isn't spending it so fast that we're also creating sustainability issues with programs. So again, I think we're in a good spot. I put this QR code here. If you scan it, it'll take you straight to that opioid settlement page. Again, all of this stuff you can access on this website, completely public information.
Your agencies and programs that you distribute money to, do they report back to you the actual program and what they're doing and how they're spending the money?
Yes.
And all that's included in?
Yes. And I want to pull up the reports in just a little bit. So the first year when we sent out, we didn't have any guidance on kind of what we were going to need to report on. They gave a very general statement on the Opioid Settlement Fund website. And since then, we've learned a lot, and also OSTAT, which is Opioid Settlement Technical Assistance Team. They're a great resource, and they've been able to provide different resources for reporting. So we've really upped our reporting game and learned a lot, of course, in that first year. But we basically, and it is an administrative burden on these folks that receive these funds, we've got to see all the receipts. We've got to be able to tie every dollar to a strategy. Because at the end of the day, we've got to answer for those funds and make sure they were expended correctly. So.
Well, the reason that I asked the question is it's interesting to see which programs you're getting the most bang for your buck.
Mm-hmm. Exactly.
Which program is working the best?
Yeah, and those reports can steer future funds and what's worked, what hasn't worked. And so, yeah, and we'll show you that here shortly. The other thing I wanted to try to understand is, at a glance, when I look at these counties, when I go through and say, well, what have they spent money on? A lot of what I see is counties investing in county departments. And I was really curious if that was just my perception. And so I went through and I've picked a few different sized counties. And here's kind of what you can see as a breakdown. Most of the larger counties, they're doing a big chunk to community providers and then 20 to 40% to county departments. So like DSS, EMS, public health, health department, those kind of things. Mid-sized counties, you're seeing kind of middle of the road, 40 to 60% one way or the other. And then smaller counties, you're seeing a lot of them reinvest back into county departments who have existing programs, whether that be EMS, DSS, and so on. So again, I wanted to see how we stack up, and I was actually, again, very proud that we've done, I think, a great job at investing in the community. So 2/3 of the funds that have been expended so far have gone directly into community organizations. I think why that's important is, again, we know we don't have all the answers. It takes a team, it takes a village, and it takes us building an ecosystem here and all working together in the partnerships. And then 1/3 has gone to county programs, and most of that has been to fund this coordinator position so that we can continue to make sure we're accurate in our documentation and our reporting. So again, I'm just really proud that we have committed to doing that over these last few years, and it highlights the collaboration for sure and the distributed response there. Any questions on these slides before we transition into some reporting information?
So I saw that there was no funds going towards like reentry, employment-related services, diversion. Did nobody in those areas?
Good question. So sometimes, well, here's what we learned. So the first round, y'all remember, you could apply and you could say, okay, I'm gonna put a peer support in EMS, and she's gonna go out and do follow-ups, and maybe she's gonna give Narcan. She actually probably hits a lot of these things, but each thing has to pick one strategy. So even though I might be doing work in evidence-based addiction treatment and criminal justice diversion programs, like if the peer support's going into the jail, we are only reporting on one strategy. And that part, for the state side, I get it. It makes it simple for them. That's where I think we could do better as a county, of coming together and really trying to figure out what metrics we want to capture, because this isn't capturing the full picture either. So, you know, if Crystal had 4 different strategies on her application, it's that top one that she got funded for that she's going to report on. And so that's why you see that look like that. For example, Danny Hampton's group, Freedom Life, they had some funding in that first round, which would have been, where's the housing one? I can't.
4.
Okay, well, that was there. So you can see that, but it is only one strategy, even if you picked 7 of those strategies. So that's why you see that.
And Adrian, that's the encouragement from OSAT and others on the state level, is just, we thought it would have made sense to list out 7 strategies, say, look at all the, the things we're trying to do.
Exactly.
And they said, we'll just pick one. Like, well, that's not telling the whole story, but
Yeah.
that's what we were told to do, so that's what we're doing. But they're very particular, I'll put it that
Very
way, about what
particular.
they ask of us. And so going back, I won't ask you to go back to slides, but going back to even a county of our size, and especially one smaller, guys and gals, and I mean people I work for and the community members here, I've been in county government over 20 years, and very rarely have I seen, this isn't a grant, it's not a grant agency, but have I seen somebody so particular about any one bullet point or $1 or whatever else, which is good. I mean, we're committing to spend these funds, these settlement funds appropriately in the right way, but it's very challenging sometimes to jump all the appropriate hoops, which we're doing, and so that, And I'm saying that again to the community members that have received funds to expend. There's a lot of burden on us to make sure that, and to the board here, these funds are spent appropriately. And so sometimes it is burdensome, I agree. It's burdensome on us, and I guess we're passing on that burden, but we have to. And if we can't explain how these funds are spent, the state will make sure we do, so that some attorney sitting in Ohio or California or whatever knows exactly how they're spent. And my perspective from and only is that the organizations that have received the funding so far, the 2 different allocations, they've done really good things with it. And I hear, and speaking with Adrian and Taylor and probably Ashley, some of the frustration that is there is, it's just 1 year, it's hard to do things in 1 year, and it's hard to measure, longitudinally and all that. And so, that feedback is going to me, it's going to Adrian and others, and Ashley, it's being passed on the board. This can evolve. We've got a long way to go here, and so just, again, and whenever I see these numbers, it stresses me out. But I appreciate Adrian and Ashley, and as well as the community members and agencies for jumping to all these hoops.
I think you bring up a valid point, and one I would love to do is, actually see what are we trying to track in McDowell, what are those metrics, and then put that, specialize that for us. Because like you're saying, like, this isn't painting that picture of what's actually out there, what's available, what's working, what's not. So for sure. I try to update this each year just to show you kind of the difference of what folks are choosing. So if you remember, Exhibit A is what we would call the low-hanging fruit. Those are those 12 strategies that you can pick from and say, hey, I've got this program and it is harm reduction. Give me $25,000. That's what a lot of folks are doing. What that does is allows work to happen a little faster. These are pre-approved. Everything's outlined in the MOA by the DOJ, Department of Justice, and we kind of have our guardrails and we know what we're doing. Exhibit B is more that long-term strategic planning. It took many years to see any counties really participating in this, and certainly it's been something that has kind of been there on the back burner for us to look at, and hopefully we're out of disaster season. We were just saying, what was it you said this morning that was historic? We didn't have landfall of a...
There was no landfall in hurricanes in 2025.
All right, so if we can keep that trend going, we might be sitting in a much better spot in a couple of years. So there were only 4 additional local governments that did Exhibit B strategy since last year. And that's, again, something that certainly we could dive into. So if you haven't seen this before, I always just like to show kind of what's required with the opioid settlement fund. So once we decide what we're going to spend, we have to submit a local spending authorization report within 90 days of the budget resolution. We have an annual financial report, and then the impact report, and both of those are the ones that are the bear. They are big and not a whole lot of fun. And I want to kind of pull a couple of things up here. So one is, if you are a recipient of funds, sorry, I'm going to try to work my mouse over here. This is that website that I was telling you about, the Opioid Settlement Fund website. And so if you go here to Core NC and you click the reporting tab, there is mountains of information. You can look at local spending reports, you can look at the financial reports, but at the bottom they've got a lot of resources here, and you can see what you might need to put on your report. The other thing I wanted to show you guys, for those that have experienced the quarterly report in all its glory, I know it's also not a fun one to complete, but here's what we're trying to accomplish. So it is so difficult to take the work that you do, especially in recovery and substance use, and we know from our CP program, sometimes you don't even know the metrics you need to start capturing until a year later. But we're having to take all of the things that you guys are doing and try to squeeze them into these different categories. So, for example, if strategic planning was what your funding was tied to. We've got to come through here and we've got to answer all these different questions. And so we have created a form where recipients can upload all this information quarterly. How many patients were served, what were the demographics, all of these kind of things, any success stories. So this is what the impact report looks like, and I just wanted to show that because we aren't making these questions up, I promise. We're trying to make sure we capture exactly what they're looking for so that we don't sell you short on the success that you've had and the measurable outcomes.
Is this just for North Carolina that
Mhm.
set this up?
Yeah.
Somebody needs to, I mean, that is too much information to have to.
It's a lot.
Like you said, it's a burden, and it's not even a lot of money.
It's a lot. And so imagine the first year that we had to do the impact report, we had never seen this. And so, you know, we had got those funds out the door, built that first round of impact report, and it was nothing compared to what was on the spreadsheet. So we were looking at it like, whoa. And so what we've really tried to do is make the report verbatim. I mean, it matches exactly what you guys are looking at.
And I'll say, just for everybody's benefit, including the commissioners, whether that is an external community group or a county agency, the same data has to be collected. And so that burden of, you know, data entry and collection, more importantly, is on whomever is doing the work. So it's not easy.
I may be getting ahead of things here, but let me ask this question.
Yes, sir.
A entity that has had funds distributed to them for a particular strategy, are they able to, if they see something's working, not working, to tweak that without it affecting their funding?
Yes, I would say with the caveat, as long as they are communicating, and that's where Ashley comes in. So, you know, let's say Crystal, part of her funds, she had a line item for training, and she was like, well, we were going to go to this training, but now we can't. So, and she lets us know, could we do this one instead? We don't even decide that. We send that up to OSTAT. We make an appointment. We hop on the phone or the Teams meeting with OSTAT, and that is a group of kind of subject matter experts. And then they'll even involve the DOJ, and we'll get that answer. One example is EMS wanted to do AEDs the first round to put on law enforcement vehicles to respond to overdoses. And that actually got kicked back after review, saying that it wouldn't meet the criteria. So we rely heavily on OSTAT, and we say, give us the green light or give us the red light. And that's where she comes into play. She's that liaison and conduit. So if you have questions about, could I spend the funds on this, that's where we'll come in with OSTAT and make that happen. So, good question.
So if a group approaches, say, a commissioner and says, we'd like to see money out of this opioid settlement money go to a certain program. So, and you review that and do that once a year, right? So what would be, for anybody watching or watching, what would be the timeline they would need to try to submit so they could have their request be reviewed for funding?
Good question. So at the end, we've got the tentative timeline for the upcoming 2026, and the goal is to open it up in January and give a 60-day period for folks to be able to submit those proposals. And we'll do our normal advertisements online and all of our distribution lists, newspaper, WBRM, all of our media outlets that we normally send that to, so that folks can be aware, and then they can apply and go through that process.
Once they submit and apply, and you may be getting careful with this, so if you are, just say, Dave, just hold that
No,
thought.
that's okay.
So they would go ahead and submit, and the group that would review those and make a decision would be the committee, correct?
So what we've done in years past is there is a committee that reviews the proposals, and that is made up of community members who are actively involved in substance use work. They score those, we rank them, but ultimately we will package all of that up and make sure that it is sent to county administration and the board for review and approval, and then they'll proceed. Yes. So here is, if you go to McDowell.gov, go to the website, and there's the Opioid Settlement Fund landing page. Two things you can do there. One is order Narcan. So the Narcan fund that was started in 23 is still there, and anyone that needs Narcan, you just submit that form. It goes straight to Ashley. She fills that order, gets it right to you at no charge. And again, that's Narcan that we are using to give out to the public. So you can't be selling it on eBay, but you can give it out. Also, I'm kidding, I promise. So here's just an example of the impact report. So you would choose whichever one you were funded for, and then it should, after that, only show you what you need. But there's some open-ended questions where we're looking for success stories, things we can highlight. Again, that's straight off that spreadsheet. And then they're looking for, and the reason that we put this in the report for the subrecipient is it's much easier for you all to give us this than us to try to parse it out later and call you and say, oh, actually, how many participants did you deal with last year? So this really, again, is cumbersome, but gets us what we need each quarter to make sure that we have accurate data that we're putting in. And then at the end is where you can upload any receipts and expenditures that you've had in that time period. That comes to us, and then we ensure, okay, they've had $25,000 this far, they've spent $25,000. If you haven't spent that, then we may come and have a discussion, hey, and understanding, for example, this last one, the payout came a couple months into the fiscal year, so there may be some lag, but it's that constant communication to ensure we've got everything that we need for reporting and compliance, and that you guys are also receiving those funds timely.
So there's no rollover, like if they don't expend all the funds.
So that's another thing, a lesson learned from this past year is that's why we want to stay in contact with what you've spent. It can't roll over into the next fiscal year unless we've got to alert OSTAT, we've got to do a whole other resolution, we've got to tell them when the funds will be expended. And we learned that from the Narcan fund. So that was created in that first fiscal year, and it actually carried into multiple, and they flagged us because it said it would be expended in that fiscal year. So you have to line all that out, and they don't miss it. They will catch it, and also we will, because now we've really gotten skilled at knowing what they're looking for. So yeah, so it has to be expended in the fiscal year. If not, then we've got to know ahead of time to map that out so we can get those extensions written and make sure we're in compliance. And then the reporting would carry over into the next year. And then your impact report doesn't match your financial report, and it starts making your eyeballs cross.
Well, when you're trying to run a program that may take a year to even set up, and it's going to take you 3 months to get approved for funds, well, you've only got 9 months that you can do anything with.
Yeah. And that could be another lesson learned. We're trying to line things up with the fiscal year because that just makes good sense for us too. It goes with our rhythm. But it might be that we say, hey, you're not even going to start for 3 months. We might need to write this resolution. Go ahead and anticipate 3 more months into those are things that I think on the next round, we're getting better and better each time with understanding the expectations and what's needed, what's going to work for the subrecipients.
I think one thing too, and I think I alluded to it earlier, where there's been conversations and frustrations, we can't get away from the reporting, and if I think about, folks like Dogwood, which, it's a grant, you get it whenever, and you do the reporting by their deadlines, but they don't really care, and they have their deadlines, but they don't care, it must be this and this and this. And I'm not just saying that because Donna's here, but it's a great organization as far as a grantee, as far as.
It's a lot of how we designed this one to start.
Right.
We referenced
But this is so structured and it's so rigid that I won't say it's not impossible, but it compared to any, especially like a Dogwood, it's almost impossible. But to get to that point here, as far as we can't get away from what's required, if you're only, quote, only getting $25,000 from an allocation, that is a lot of work for not a lot of money. But one of the things that could be recommended to the commissioners to decide in the future is, hey, this is a lot of work for a little bit of money for, like Mr. Green said, for maybe 9 months of good work if you're lucky. Say, what can we do about it? Again, maybe a recommendation could be made, well, let's go to longer commitment terms. Again, if somebody's not doing what they said they were gonna do or something, the organization goes defunct or whatever, you just say we're stopping. But if everything is going like it should, and everyone's committed to, you know, maybe do a 3-year grant term with $25,000 a year or something. And again, I'm just talking out loud, gentlemen, where as opposed to just 25, and we'll see what next year looks like. We know what funding we're gonna get from year to year for about 12 or 13 more years or longer, actually. And so that part is guaranteed. But again, these are things we need to hear from folks as concerns. We've heard it already, and then we can take it back to the board for decision making.
Well, that way, when you know what programs are working for sure and what's helping people the most, then you can divert resources or whatever to that program.
And the good thing is, if they're not performing, it stops. I mean, there's an accounting process that you review and match and determine the viability success. So, I mean, if I do favor maybe extended to a group more than 1 year at a time, that's providing the service that's needed, and it's like Lynn said, it's working, and you know, you got the oversight in place. So I think you're covering yourself, and you're still open up every year to any group to apply.
New ideas,
You know?
or, yeah.
So you're not excluding people, because anybody can apply during the application process.
But we've seen and we know which ones are putting their heart into it and which ones are really trying to make a difference and which ones are saying, hey, I'd like to have some of that money. No.
That was gonna be my suggestion, like, for 3 year at least,
Mhm.
for like the stronger organizations
Right.
that you know they're doing the work. Because, you know, $25,000 really isn't a lot of money, but it is some money, but if
It's
they
a
do
good-
it, and then that would take the burden of reviewing unnecessary applications if they're already
Mhm.
funded for multiple
Mhm.
years. That would take some of the burden off too.
I think kind of two lanes. One, I think this year the reporting that is way more detailed, way more encompassing, will be able to show us, okay, who's getting us the data, who's providing all the financials and the impact reports. I think it's going to shed a lot of light on, you know, who can kind of perform what's expected of us for this process, because it is really cumbersome.
Well, and the group would have to have a strong, as Ashley is our person, would have to have a strong system in place just to handle the accounting side of it.
And that's where I wanted to make sure, especially any subrecipients in the room, like, if you're like, I don't want to upload all these receipts in here, if you want to come up with a different process where you bring us a folder every month, or there are administrative things that I think we are happy to take off of folks, especially because this position exists, where if it makes life easier, and we've already helped a couple of groups with their reports of just either on a Zoom call or come by the office, we'll help you. I think it will make it easier. I would also say, I think, again, while not perfect, we've learned a lot along the way. I think I am really proud of the way we've been able to get this money out, even though it's not been perfect, and we've went quarterly, now every 6 months. Because the other thing I looked at is, what are other counties doing, right? Like, let me try to get some ideas of how other counties are getting this money out into the community. And the vast majority are doing reimbursement only. So you bring your receipts, they reimburse you for what you spent. Not as equitable and not as easy for, like you're saying, these programs, but I think it also speaks to, you know, trying to do the best we can. We're a smaller organization, a smaller county, but also we're putting the effort into keeping that fund flowing so that work can happen, and we're not just lining it with red tape. We're trying to cut some of the red tape for everyone so that we can keep it going. So,
You know, when we're trying to stabilize folks in recovery, that can take a year. So to be able to report out on, like, we apply for recovery housing,
Mm-hmm.
to be able to report out on those cases after 3 years to see if that program's really working, instead of just the year it took to stabilize that
Mhm.
person out of crisis,
Mm-hmm.
would be amazing.
Okay. I got it in my notes here. I totally agree. So we've got, again, financial report, the annual impact report, which is kind of what we just went over. The status survey is pretty simple. That's something we do each year to check in with OSTAT. But we stay on the phone with them so much that they pretty well know kind of where we're at. And then the annual meeting. I'm not going to beat a dead horse. We've talked through this. I think we understand. We are trying to be difficult, and I really want to share that with folks. We've said it in all of our MPSA meetings and meetings with subrecipients, but if I could make it go away, I would. But it's not going anywhere, and it's here for the next 20, 30 years. We're tied. Every dollar has to be tied back to an approved strategy. Period. End of story. And then the other thing I would encourage folks to do if you are a subrecipient is, especially that early year, is make sure that you have audit-ready documentation. And that's, again, why I think a lot of other counties, especially smaller ones, go with, let me just push some of this money into DSS or the health department, because they already have that financial system set up. But again, being good stewards and getting it out into the community matters as well. I think y'all got the reporting part right. You know how important it is. So here is our kind of 2026 tentative outline for what we want to accomplish. So January, February, we would open applications. That would be on the website. That would be our standard form that we kind of stole from Dogwood. Thanks, Donna. And that nothing there. I don't see any changes there. We would do the application review where we make the committee of panel members and the scoring rubric and prepare that for commissioner review in the spring, notify the applicants, and then spend May and June getting those agreements and resolutions and everything that OSTAT requires, getting that ready and approved by finance for July 1 project starts. So again, I think there's a lot more to flesh out in meetings about, you know, what this could look like for future funding rounds with multi-years. I really think the financial reporting piece we've got ironed out. So that was really my stressor last year, worrying that, you know, we weren't doing things by the book and making sure that we've got everything we need to protect subrecipients, the county, and make sure that funds are being used and we're good stewards of the money. So,
Do y'all send out a letter just to all nonprofits to make them aware of that they can apply for possible funding for programs they offer?
So we rely heavily on our community groups. So Kitty Wilson from MPSA, her distribution list hits probably everyone in this room. And then folks can continue to share from there through their webs of distribution systems. We do the newspaper, we put it on the website. Can you think of anything I'm missing, Ashley?
No, I think that hits it, and we do get emails or contact from people from out of state and out of the county especially.
Yeah.
And we've tended, and then we'll take a quick look at them, but usually we just kind of put them at the bottom of the list. If it seems to be, which usually it is, somebody that doesn't have our best interests in heart and they just see money, they have no program in this area, and they're to come in and start something new and all those sorts of things, and they just want money.
Mm-hmm.
So they might be like an NA on the bottom of the list or something, but yes.
Do we not restrict that to McDowell County? I mean,
We kind of inadvertently have. We haven't funded anything that isn't McDowell County.
because the county chose to participate in the lot of settlement, and I think that our local people should have access. I don't favor sending that to, even doesn't apply if they're out of county.
I
People
think
have to be bought into this county before. I agree.
Black Mountain Counseling Center would be an example of, you look at that and you might say, well, Black Mountain, but they have an Old Fort office that they were establishing.
Well, that's different. I mean,
So that's where you might
they're
see
local
that.
and they-
But no funds have went to a program that's not in McDowell County.
Right.
Yeah.
Because each county has their own
if they
So
were
it's
part of the
just-
settlement, but yes, yes. Yeah. Questions on this or comments? Okay.
It's a good job.
Again, I really encourage people to go to the opioid settlement website. There's so much good information on there. I like just looking at what other counties are doing to get ideas, to see what programs are starting up. And sometimes I'll call them up and ask, you know, what's their success been. But lots of good info, lots of good data. I encourage you to visit that website regularly. And then the McDowell County, so mcdowellgov.com, and then there's an opioid settlement fund tab that you can click on, or you can do the / if you want to type all that. I'm not that good. I just Google it and go. But you'll see once the applications are open, that'll be live and on there. And then at any point that anyone needs an Narcan for their organization, you can request that. We even do county departments through there, transit, the rec, fire and range, things like that, library. And that's just so we can track, hey, here's how much Narcan we've given. So it's more of that tracking mechanism and keeping things organized for Ashley. So, all right. Any questions or comments for the good of the group? Any updates? Certainly, if anyone who is a subrecipient wants to provide any updates or insight, we've got a little bit of time.
Just a comment I want as a team member of Adrian and Kaylin and Ashley, thank them for what they're doing, working beside them every day. Adrian is leading very complex programs, not just on the substance use side, but on the lean side. She's got some very technical programs that she's in charge of, and the workload she's carrying is, honestly, I'm not sure how she does it, but she does an amazing job, supported by these other team members. And just want to give a shout out to what she does and keeping up with this very technical program. So definitely.
That's how we do it. Everybody pulls their load for sure.
We always appreciate our partners for their diligent work. It's been a tough couple of years.
It's been a tough couple of years.
Could you introduce some of the recipients are here tonight, right? Could you introduce those to us?
Yeah, absolutely. So in the back, we've got Tim Nolan. I'll mess up your organization name, Tim.
High Country Community Health.
Yes. So Tim has been a phenomenal partner with EMS, with all these peer support groups, with the shelter. He does a lot of, I guess, kind of street intervention, MAT. So if we have someone who is overdosed and we go out to them, we can immediately start working with them to offer them treatment services. We can dose them with Suboxone and then connect them with Tim, who can really provide primary care essentially and kind of a full spectrum of care. So I'll let you elaborate a little. We love Tim.
Yeah, I like McDowell County and the wonderful peers we work with. So yeah, I'm with High Country Community Health. I'm a nurse practitioner. All my work is really fentanyl and Hep C. So we do what's called low barrier care. So there's a whole bunch of people out there that really don't access points of care because of their chaotic lives or mental health, whatever. So we meet them through harm reduction and really have engaged so many folks either in low barrier medication assisted treatment, peer counseling. We have a therapist who works with us through CareNet.
Mm-hmm.
And we have a psych nurse practitioner that goes out with us once a month for the more complicated psych cases that we're working with. And we do a bunch of low barrier hepatitis C treatment. So we test people right there in the lousy place they're living with a rapid. If they're positive, we draw their blood right there, and we get them medicine. We bring medicine to them. A lot of that is done. We have peers that are certified to draw blood, and so the provider has less and less need. Hep C is very easily treated, so I am sure that it's reducing Hep C in the community, which is a huge money saver. my opinions. So yeah, we do a lot of low barrier care. We're out in your community every week, and then Friday mornings, I'm at the Project Impacts Drop-In Center, and we do a whole bunch of medication treatment there, and mental health, and Hep C, really to folks who just don't access it other places. Does that help?
And then we've got Crystal Hensley, so she oversees Impact Peer Support Services, who truly, that was born out of a grant, a KBR grant, like 10 years ago probably now. EMS, the shelter, and DSS, to start peer support in McDowell County, so that was kind of the first organic group. It's how we were able to get our peer support at EMS, so why don't you share what y'all have going on?
So we're just a team of peer supports all in recovery from substance use. We have a recovery community center in town on Railroad Street. We do outreach each week, and we're out in the community a lot.
So your group is the one above Mary Ty, right?
Yep, that's us.
Okay, great. I was wondering.
And then y'all also have the peer with Marion PD, correct?
Yes.
So they've got kind of two things that are supported by opioid funds, the
Can
law
I add
enforcement
to that?
peer. Yeah.
Sorry you offered to talk. Yeah, we've also reached out to the parole probation office and have gotten tremendous referrals. So that's a huge risk when folks are coming out of incarceration for overdose. And so we've had several of the officers really buy into what we do and make referrals to what we do. And then we'd love, there's rumors of trying to get medication-assisted treatment into the local jail, and with EMS involved with that. So, other counties are doing that. It's a huge lifesaver. So we'd love to be part of that. And you guys have the power to push that forward.
You know, I always, when I'm thinking about these things, revert back to my law enforcement career. I've seen programs come and go. I've seen some successful, I've seen some fail. But to those folks that try to run a program, the reality is, in my mind, you're gonna lose some, but you're also gonna save some. I've seen them that said they were doing everything they were supposed to do, and then all of a sudden, they're no longer with us because if they relapsed, went back to the same thing. I've seen others that have been clean now for years, and it's because of the folks in the community that care to go the extra mile and to try to get those folks the treatment they need. And I'm thankful for our faith-based programs because that is a sure way of getting cleaned up. It's when you give it to the good Lord, He will take care of it. But that also comes with the needed peer support and those programs to follow up and make sure that those folks are staying strong.
And that's exactly what they're doing. The peer support program, and like if we didn't have those partners, a big portion of our program wouldn't be able to happen. So without the referral resources, that's where we struggled for a couple of years to really kind of get our wheels moving on some of our programs. So they've been great partners. And I'm really sorry I've lost your name, but RHA. Malachi from RHA. And do you want to share a little bit about your program?
Yeah, so Teen Intervene is something that is about to get started in the schools in McDowell County, which I'll be going in and facilitating. It's kind of an alternative to suspension, where instead of being suspended, the kids will come and we'll do 2 sessions with just me and the youth who has been caught or is being punished for some kind of substance use, usually a vape. And we'll just go through role plays it's just different things to help the youth to come to their own conclusion about why substance use is bad for them. And then the third session involves their parents, which will involve me speaking with the parents about, techniques to help their kids avoid this behavior in the future. And so that's something that we'll be doing in McDowell, starting this year. Yeah.
Thank you. And then we've got Crystal from Mission. Give any updates?
Yeah. So Mission Ministries Alliance, we're a large group of peer supports that operate a low barrier shelter approach. So we use a housing first model, which is one of the options. But like Adrian said, we kind of cover so many of those areas with our work because we take referrals from probation, the jail, EMS, law enforcement. So we do believe we make the county employees' jobs a lot easier because we're the only residential facility for folks to drop folks off at so they can go home and be with their families. So because of opiate funds, we were able to, I tell our peers all the time, if you're not talking about housing in your case management, right now you're not doing case management correctly. So we are a housing focus or higher level of care for folks who come to us. So we've also been able to follow them for up to 3 years while they're in their housing units because relapse does happen and folks can go into crisis mode at any given life event. So we're able to support them so they do not. We've been able to reduce recidivism into the shelters by following them with an additional peer support in their housing units. So we've been able to do some amazing work. It's difficult to do this work in this county because we do not have a mental health crisis bed to get folks in. So we're doing a lot of that work inside the shelter. We're allowing folks to detox inside the shelter who do not require a hospital level of care because we're driving an hour to transport folks to those detox facilities. So we're able to do a lot of that in the shelter. We do not allow folks to detox off of alcohol, benzos, because there is a severe risk of having those in our building. So we try to get them to a hospital level of care. So we do a lot of that. But the work we do in shelter with peer supports allows us to create a trauma-informed environment for them and lower all the barriers we can for access. So we recently, over the last couple of years, allowed pets. So that's a barrier for folks to come in. They come really close with their dogs or cats. So whatever the barrier is for them coming into shelter, we try to lower that. That prevents them from being outside. And then we've been able to follow them for a longer term. But the evidence-based approach is housing first and trauma-informed care within our shelter and our homes.
Crystal, you said that you provide transportation to detox facilities.
We do.
Does that mean that is a voluntary thing for those folks? Can they leave that program anytime they want to, or?
So it has to be voluntary because the detox unit will not talk to us, so they have to talk to the meeting. Same with mobile crisis. We call mobile crisis because we think someone with a crisis, they have to talk to that individual. And even if the individual gets on the phone and we're not in the room, they can change their whole story. So the person really has to be person-centered and driven by that person for them to go. Yeah. We also do a lot of IDCs, work with the police department on that.
You initiate those? Okay.
When folks are a risk to their community, those are hard to get though, but a lot of times it's needed to get those. Yeah.
Deborah, you have anything to add on the shelter front or East Marion? And Donna from West Marion. You got any updates?
We're just actually fundraising. We almost got enough to do our initial first phase of our building that we were gifted. We do have a letter of intent from Party Hospital to bring a behavioral health clinic to the building. So
And a pharmacy, right?
yeah.
Yeah, that'd be a big one, for sure. Anybody I'm missing? You got any updates from EMS?
Not really, it's just interesting to me. CP program started because we were trying to catch the patients that fall through the cracks, and I feel like these organizations now are like the fail-safe for the fail-safe, because we still have those patients that, despite every resource we could give them, there's something that's causing them to not be approached or addressed in a way they need to be addressed, and so this is making it more person-focused instead of us trying to like blanket cover things.
Mhm.
We've got people that can individually work with these people, and it's like Crystal said, it can be frustrating because it can take up to years to get someone to their baseline, but when you do it and you see it, it makes it all worth it. And so like having these partnerships is really, really good, and being able, I mean, I know the paperwork and stuff is awful, but in this day and age, you have to prove why you're doing what you're doing, and I feel like this group of people, it doesn't matter what kind of obstacles we're getting, we're gonna put in the work, we're gonna do it, and we're gonna keep fighting for our community. So
For sure.
I just, CP's here for everybody.
We're here for everybody. Yeah. Definitely, I echo Kaylin, like seeing the way the resources have evolved in the 18 years I've been here. I mean, we still got work to do, but it's really impressive. And the partnerships in McDowell are always above and beyond anywhere. I mean, Will's traveled, I've traveled to other places, even in disaster. I mean, every one of y'all showed up here at some point to help on hurricane items and staffed call centers overnight. Y'all took the night shift. I mean, it takes a village, and we're all just going to show up and keep doing it. So thank you all. Anything else? Have I missed anyone that has something on your heart tonight you want to say? Okay. All right. Well, we'll call this meeting done, and appreciate everyone for coming.